Welcome back to taking drinks out of fire hoses again. We're going to cover a lot of information today. Next week it'll be a little simpler, but we'll get more into fitness and cancer next week, and then we're going to wrap it up in the last week with question and answers and some miscellaneous topics. Today we're going to start with infections and go into the gastrointestinal disorders, talk about autoimmune disorders, and then start talking about the back. Yeah. The forum is in a different place this week for those Mendocino 1005, 1003, which I guess is the overflow. Those people who want to do the forum.
Do you want me? Let me just say one thing. Because you all got an email, but if it didn't sound clear, this is the first time now that you're going to have access to be able to live stream it at home. And so if you're not at home today, but there's a way to register on that email, and then at your convenience in a few days, it will be available to watch from your laptop at home. So go back and look at that email that you got, the constant.
The other thing, logistically, I didn't send out any pre-work for this week. I gave you guys a week off. Not because I was thinking of you so much as I was a little bit behind, but also there's just no good information on these topics that are singular, and I don't like to send out a lot of information because I've come to the realization there's not enough time in the day. This is Jack Dixon. He's going to provide a lot of the information on fitness and the back stuff we're going to start today. He's a personal trainer down in Santa Rosa. I'm going to try and talk without the microphone, so you can hear me. Talking isn't going to be a problem. Anyway, Jack works at the McDougall program. He's been a personal trainer for a number of years, so he gives talks at the McDougall program on fitness. They're very good, and I'm going to share information that he's provided as we go along for the next 3 sessions, because a lot of people in their questionnaires are interested in fitness and mobility and things like that. And he's certified by the National Strength and Conditioning Association. And then Jeff Nelson, he and his wife founded VegSource, and they gave a lot of conferences for a number of years, and he's the executive director for EarthSafe. He was the person who helped set up the Meals for Health programs and fund the Meals for Health program that were responsible for some of the patient clips I've shared. And and he also took a lot of the videos he took that are on the EarthSafe website and sort of skinning them down so they're shorter to 1 or 2 minutes. So today we're going to talk about infectious diseases, give you an interesting perspective on infectious diseases I don't think you've probably appreciated before. We're going to go through reflux disease, constipation, diverticulosis, colitis, irritable bowel syndrome, take a break, and then we'll go into autoimmune disorders. I still haven't figured out how to send out the slide pack without it coming back that it exceeds the server, whatever that means. Then we're going to hit some autoimmune disorders, and we'll talk about the back and wrap it up. So, proceeding down our list, we're not going to do too much with the causes of death, although the infectious diseases sort of gets into this, or the chronic respiratory diseases, but not really chronic. But we are going to talk about arthritis, rheumatism, back and spine problems, and also stiffness and deformity. We're going to start getting a little bit into inflammation, although we'll do that a little bit later in the last class, time permitting. So let's talk about infections. There have been 3 eras of emerging diseases in human history. The first one started when we domesticated animals about 10,000 years ago. And if you look down this list, you can tell where the various ails came from. Okay? So you can see that the common cold came from horses, and influenza, which now actually comes more from birds and is spread human to human, but was originally a waterborne infection in ducks, but it jumped from ducks to chickens and became respiratory somewhere along the line. It wasn't until about 10 or 15 years ago that we finally figured out what the infective agent for IT has arrived.
Is the microphone working?
Huh?
Is the microphone working?
Yeah, it's working.
Okay, I'm just here to check to make sure it's...
Yeah, it's checking, it's working. We've decided, it was being videoed, and we decided just to go with my voice instead of the microphone. We didn't know about the volume control on the microphone.
Do you need help with it?
You have? You want some volume? Want to know how to do the volume?
The only issue is it's so much bass that it's really rumbly, so it's really hard to understand you on the video, unfortunately. So you're actually better in person.
That I could help.
Okay, got it. So thanks for coming by, but the microphone does work.
Awesome.
Great. Thank you.
Sorry for interrupting.
No problem. We figured out finally what caused leprosy, the infectious agents in leprosy, about 15 years ago. But this was the first error. And then we moved into the second error, which is really not infections, but with processed food and industrial farming, we got heart disease, cancer, diabetes, and obesity, which really weren't very prevalent, before about 100 or 200 years ago. And back when I was doing my rotation at the medical center, one of the first rotations I did in medicine was in the infectious disease team with a guy named Hoprick, who had written one of these textbooks that was about this big, And at that time, in the mid-70s, people were being told we don't have to worry about infections. We've got immunizations, nobody's getting sick, we've solved the childhood illnesses, and then things started taking a turn into unanticipated consequences. So we started having a lot of foodborne illnesses we didn't have before. Campylobacter, Salmonella, Listeria, E. coli, all these bacteria live in the animal's intestines and get to us because we either eat the animals or because of contamination from their feces getting onto plant products. So that in this country, you have a 1 in 4 chance of having a foodborne illness every year if you eat a standard American diet. You have about a 1 in 840 chance of being hospitalized, and you have about a 1 in 55,000 chance of dying from a foodborne illness. Thanksgiving turkeys, 9 out of 10 have Campylobacter, 75% have 2 or more. The second organism is usually Salmonella. That's why you cook it at such high temperature for so long. And there's lots of recalls for Listeria and E. coli. So what started happening? What was a little different? The first new error in the third era of emerging diseases, AIDS was the first one. Started in 1981. Lyme disease came about in 85. Then you start hearing about all these viral hemorrhagic fevers, mainly around Africa. Ebola, SARS, more recently, you've started hearing about it because what do we got going on now? Coronavirus, right? SARS came from meat industry and civet cats. The good news is we were able to contain SARS because people were sick before they were infectious. So they started running fevers, but they weren't contagious yet. It's easy. You just find people. I know I was taking a plane trip with the family, and we were coming back through, and we were being screened to see if we had fever. And if we were going to have fever, they weren't going to let us fly. So the trouble with coronavirus and influenza, I know this for influenza, we haven't seen much data on corona yet, but I'm beginning to think it's a little bit like this, like the influenza. You are infectious for 2 days before you're sick. So you're, even with good intentions, you're walking around spreading the illness and you don't know it. That is impossible to prevent the spread. And we'll see about what happened in 1918, for those of you who remember the Spanish flu days or read anything about that. Now, bird flu, concentrated animal processing, we think the coronavirus may be coming from pangolins. I didn't know what a pangolin was until this one came out. They started talking about it. It's an anteater that has spines on it, little plates. And the Chinese use those plates to make medication. Now, since this has gone out, the good news for the pangolins is the Chinese have stopped covering all those medications. So with a little bit of luck, the trade to kill and import pangolins into, they're not small animals, they're about 75 pounds. So to summarize the third era, we got factory farming giving us flu and foodborne illnesses. Bushmeat gave us AIDS, SARS, and Ebola. You can probably add corona to that. Exotic pet trade and animal trade gives us monkeypox and West Nile, and environmental degradation gave us Lyme disease. that was suburbia that gave us Lyme disease. We killed off the predators for the little white-footed deer mouse, which is one of the intermediate predators, carriers for Lyme disease. Now, when I was going to medical school, we didn't even know about prions. Sheep had a disease called scrappy, described first in 1730, and eventually it made its way somehow from sheep to cattle. 1986 was the first documented case in cattle. This stands for, it's a spongy encephalopathy, so it actually, the prions are little protein molecules. They're not even alive. They're not even viruses. They're just a protein that gets into the people's brain or animals' brains and causes the proteins to fold. And it sets off a chain reaction. And that was okay until, and then it jumped to cats. In 1930, there was a Max, a pet Siamese cat. He died of feline. Every time it goes into a different species, they rename it. But then a 15-year-old girl named Vicky Reamer in Wales died from it. And it led to, at that point, 100 British youth dying, and they were up to 100, by 2009, they were up to 167 deaths in the UK attributed to this disorder. As a matter of fact, to this day, if you travel to England during a certain 6-month period of time, you can't get blood in this country. It's also why, in this country, we do not allow them to take the central nervous system, the spinal cord, and the brains of animals like cattle and chop them up and feed them back to the cattle. Because what they don't sell to humans, most of the stuff that's waste in the concentrated animal feed industry gets fed back to the animals. And periodically, they do autopsies of like hot dogs and hamburgers to see if this is true. And I've got some, I didn't put a slide in for it, but just to let you know that the autopsies they did on all-meat hamburgers showed that the amount of meat, the highest amount of meat in an all-meat hamburger is 16%. There's an interesting collection. That's the bad news. The good news is there was no central nervous system tissue in the pathology report. Nice way for pathologists to do their work, I guess. So in 1918, we had avian flu. It was an avian flu virus. It infected about half the world's population. It spread around the world in those days by steam transport. Now we've got airplanes and closed containers going long distances. It actually, the best hypothesis for where this came from was in the camp outside of London, where they had lots of animals and lots of people. They had soldiers that were being trained to go to the front in World War I, and they were bringing all those sick people back from the front in World War I. Nobody knows where it started, but they think that's the camp that it started in. It had only a 5% mortality rate. That meant 5 out of every 100 people died who got it. It still killed over 50 million people in the world. AIDS killed 25 million people over 25 years. Now, up to 2006, there were 5 different strains of avian influenza outbreaks. One person was killed in the Netherlands for a very small number, but there was good transmission. So once these things jump to humans, there's 2 issues. How infective is it, and how deadly is it? The H5N1, also called the bird flu, which was in 2005, 2006, killed only 200 people, but it had a mortality rate of 50 or 70%. That means if it got out into the general population, half the people in this room would be dead. I didn't put it in the little cartoon I have, the bizarro cartoon about the doctor who's got the earth on his exam table, and he's telling the earth the bad news: you've got a severe case of the humans. The good news is they've about run their course, and you're going to be feeling better soon. So clearly, if we wiped off half the people in the globe, probably our environmental footprint would go down.
How did they manage the bird flu if it's that severe?
How they manage it?
Yes.
They require all individuals to stay in their house for 90 days and not go out. Rolling quarantines.
Where did they do that?
Philadelphia. There were cities in this country that did it, and their mortality rate was much lower, because you can tell people to stay in their house, but you don't really believe they're going to do that, do you? We're talking food, we're talking water, The recommendations from the CDC back in about this time were 90 days of food in your house. That was a federal recommendation. Now, I looked for those recommendations currently. It's no longer there. I don't know if they've changed it or took it off or whatever. But the bottom line is the only way you can stop it is to put people in set places and keep them from contacting other people. And even in cities like Philadelphia, where they did rolling quarantines, rolling quarantine is 90 days you're in your house, everybody gets to go out for a week to shop and stuff like that, go back to work and things like that. I mean, you can imagine the disruption. So that's the only way to manage it. Because and that's what concerns me about the coronavirus, isn't the fact that its its mortality rate's only about 2.3% at this point. So that means of every 100 people who get infected, 2 are going to die. There are even some mild cases now, and also cases of people who've tested positive for it that never knew they were sick. So we got population variability, so it's got a very low mortality rate. But the question I keep looking for in the papers, and I haven't seen it, although I saw an is it infectious before you're sick? If it meets that criteria, trust me, there's no way it's going to be contained short of rolling quarantines. And I doubt very seriously if the government is going to issue rolling quarantines for something that has a 2% mortality. Now remember what the definition of a pandemic is. A pandemic is just, it starts in one country and it's spread to 2 other countries. It doesn't say anything about how bad it is. Although if you read the paper, pandemic sounds really bad. It doesn't necessarily have to be bad. It'll meet that criteria. So the coronavirus is going to be interesting to see. I'm just hoping we'll be able to finish the course before they lock the place down. And I haven't laid in food stores yet for anybody who wants to know. Yes, ma'am.
Did you have had to have the coronavirus in order to have an antibody, or are there any?
Yes. At this point, best we know. The tests for antibodies are pretty specific now, but there is possibility of cross-reactivity. I mean, even the 1918 avian flu virus, it tended to kill people in 2 peaks. And it wasn't the old necessarily, it was like middle-aged and young, which was really an interesting, and that almost tells you that those other populations had some little bit of an immunity. Maybe they had exposure to another. And then I looked at the paper today, we're talking about the number, they report the mortality for corona, but they won't report the % mortality for the flu. Although they give you the numbers and you can do a pencil and paper. And I was sitting there doing the pencil and paper and I'm going, that sounds awful low. And then I suddenly realized that we have immunized a lot of people in our population. And even if we don't get the virus just right, that might provide partial immunity. So it's hard to compare. It's like comparing apples and oranges. So, yes, ma'am.
What are the symptoms to coronavirus?
It's upper respiratory mainly. Cough.
Would it vary from the symptoms of flu or cold?
Nope. These things get into the body, you've either got intestinal type infections or you've got, you get exposed by food or you get exposed in the air and you get a respiratory infection. And, the viruses are just in your body. They're starting to just reproduce, right? That's what they're just trying to do is reproduce. And your body's going to fight them off and eventually you're going to win or lose. And it looks like most people win in the fight for coronavirus. Yes, sir.
An interesting book about the 1980s epidemic whose type was sued and Walter Gina Colada.
He just made a comment that there was a book called The Flu, which was just about the 1918 influenza. They actually isolated the virus. They dug a corpse up, I think, in Alaska or something that had been frozen.
There are several chapters about that aspect.
I'm sure that we have weaponized this now, and if we were to go into into Fort Meade outside of Washington D.C., where we have all our biological weapons, we'll probably find it. I'm sure they've got it, and I'm sure they've sequenced it and know what it is. But and they've also developed some vaccines against some of these things, not yet for the corona vaccine. But here again, how do you make it fast enough, quick enough to get it out to large numbers of population? So I think getting back to Art's question, which I think is a great one, how do you contain something like this? It's rolling quarantines. Whether the government has the will and the political will to do that or not, we'll be seeing, depending on how bad things are. But
After World War II, we had the polio epidemic,
Right.
and my father had polio. We were quarantined. And a big gold, a yellow Q on our front door. And now, there's discussions of that when the AIDS, it was just it's just, the culture is so different now that I don't think we could do it. But, yeah, the friends of my dad, he made it in the hospital, they were all under quarantine.
Yeah. If it gets spreading and half the people are dying and people are looking around legislatures and half the legislators are dying, we might get some motion.
Well, maybe. On the other hand, you might be happy that.
There you go. Yeah, we could take a vote on that for one of the little of us that are left. You didn't throw the queue away, did you? Well, it sounds like they're pretty easy, but that's interesting. I never even heard that history that people, I had a cousin who had polio, and polio was actually an intestinal infection, and a lot of people got polio that didn't get the paralysis.
Right.
So all these viruses have, in addition to the mortality everybody's scared about, they have side effects, whether they're neurologic or intestinal or respiratory or things like that. Thanks for that comment, Art. That's really a nice history.
That was in Small County. I don't know if it was a local county public health.
Yeah, I'll look into that and see. Maybe I can make a comment on that in future class.
I have a question.
Yeah.
About the virus.
Yeah,
So
sure.
My understanding is that the virus, let's say if the virus sits on something, like when you pick your food in the store or your hair or something, the virus, if you have the virus and you cough and the virus sits here, it doesn't live for very long. It's when it's transmitted directly, right? And then the body gets so
Yeah, more so, but you probably, it does look like if you wash your hands, you decrease the transmission rate.
If you don't,
If you do. The masks don't help evidently, but the washing of hands does. So here again, it lives long enough on surfaces that it can be transmitted from person to person. And that's some of the disturbing stuff. If you go to nutritionfacts.org, find out about the bacteria in animals produce that you buy in the meat part of your supermarket, and how those packages have bacteria on top of them, and there's plastic bags you're supposed to put the stuff in so it doesn't get on the cart and stuff like that. So, yes ma'am.
So how do we know how long the virus does live on surfaces?
I don't know if they've done that for this particular virus
Think
yet.
about all the stuff that we've gotten from China that's now in our Target stores and everywhere.
I'm sure it's being studied, but that's an excellent question.
I think I just heard something from CDC saying 9 hours
9 hours
on hard surfaces.
on 9 hours on a hard surface. That's probably accurate. But I'm sure there are a lot of other factors, how humid it is, how dry, the temperature and things like that, and how many are put down. And you're talking about a hard surface, and there are lots of non-hard surfaces, a lot of variables. So basically, animal products and contaminated plants are where you get these 24 hours, what I would see in patients 24 hours. These are usually foodborne illnesses. So here's a bizarro cartoon. I'll have the cruelly tortured for its entire life, kept alive with drugs, slaughtered inhumanely, processed unsanitarily, and cooked at very high temperatures to kill the salmonella sandwich. So on the infection, so we had 3 errors of disease, maybe a different concept. It's published in a paper by Michael Greger, who was the nutritionfacts.org doctor back in 2007. It's an interesting paper to know where all these illnesses of humanity came from originally. So this is just a GI. You've got a feeding tube that comes down through your mouth, the stomach. You go into the first part of the intestine, the duodenum, and then you go into about 27 feet or so, 30 feet of small intestine, and then 6 feet of colon. And then you go out the other end. And we're actually designated, we're hindgut fermenters. In other words, we ferment or digest fiber in the back part of our gut. Cows are foregut fermenters. So animals that eat a lot of plants or are designed to eat a lot of plants have a long intestine because plant cells have a very thick cell wall. It's hard to break down as opposed to animal cells. So that they either do it in their foregut or their hindgut. It's where they ferment the fiber. And we ferment the fiber. We talked about the short-chain fatty acids that are made, the 2 and 3 and 4 chain fatty acids in the first class. And all the primates, elephants, and humans are all hindgut fermenters. Cattle are foregut fermenters. So if we look at the stomach, This is a little bit of a design problem. You put stuff into your stomach, and it's supposed to go out the bottom end, not come back up the esophagus. So this is the gastroesophageal reflux area right here. And so things hit the stomach, you outpour acid into the stomach, which you're supposed to do to help digest it, and that acid causes relaxation of this sphincter. It also relaxes the sphincter at the other side. So it's a little bit of a design problem. You know, you put a lot of food in your stomach, you get acid, it relaxes both ends of the pouch, comes back up. So there's some things you can do to minimize that problem. But fat in the diet seems to make it much worse. In other words, fat in the diet delays the emptying of the stomach, which causes more food to go up. So one of the central things you want to do is eat low-fat, whole plants, which have very little oil and have no added oils in the cooking, if you have reflux. As you gain weight, some people notice that they gain it around the middle. That sort of makes a little bit less space for the stomach to expand. You want to avoid lying down for 3 hours after a meal. You can elevate the head of the bed 4 to 6 inches to sort of help prevent gravity from taking its effect. And there are some specific foods, raw onions, coffee, decaffeinated coffee and tea, capsaicin and chocolate, unfortunately, that have been all implemented in making GERD worse. Now remember what we said at the beginning, everybody's an experiment of one. So if you're having GERD and you try this, some of these things may work better than others. So it's just a question of working, seeing what works for you. But I would certainly start with the diet first and achieving a healthy weight for all those reasons we talked about before. Constipation is an interesting problem. There is no definition for it, which is kind of interesting. It almost leads to be a functional definition because it's been defined as anywhere from 3 per day to 3 per week. I had one patient in my practice that had a bowel movement every 7 days, which I found a little hard to believe, but she evidently had no symptoms. Constipation is very prevalent, it's very costly, and these are just the hospital costs. These are the costs in hospitals around the country where the primary diagnosis was constipation. That's the reason the person was put in the hospital. It tends to be worse at both ends of the spectrum, young and the old. Not that it would apply to anybody in this room, but the pediatric population, almost 70% of constipation is cured just by eliminating dairy products, which is interesting. Fiber is increasing fiber by eating plant foods because all your plants have fiber and the animals don't. Decreases the likelihood of constipation. Then you want to minimize and eliminate low fiber foods, and regular, moderate, or vigorous exercise has been associated with improved bowel habits. So the definition really isn't numbers. It's, do you feel like you have constipation? It's almost like, are you fully evacuated? You know, is it causing you symptoms, bloating, and things like that? So it's an individual's choice. Constipation. Diverticulosis is a condition where we get little outpouches in the colon. It's very common. It's 50% over age 50 people have these in their colon. And it's caused by a low fiber diet. So for those of you who've had physics, and I can't remember the actual equations, although somebody in this room might be able to help me out, is if you have a very small balloon, it takes a lot of pressure to blow it up. And if you've got a big balloon, it takes a little pressure. So if you've got a lot of fiber in your colon and it's big, it doesn't have to squeeze as hard to move it along. If it's small, it's generating more pressure. So the thought is that the smaller diameters with the low fiber diets gives you these little outpouchings, which are little like balloons that come through the actual muscles in the colon wall. Now, they're fine by themselves and they don't usually cause symptoms. At least that's our current thinking. But they sometimes do get infected. And if they get infected, they're almost like little appendixes. They have to go in surgically, remove part of the intestine, drain the pus and the abscess and things like that. So it's a significant disorder. Irritable bowel syndrome. Irritable bowel syndrome is a syndrome. It's really what I would consider, I made a lot of that diagnosis. You bring people come in, they come in with either nausea, vomiting, diarrhea, constipation, and abdominal cramping, and you look and you can't find anything, then you label them with irritable bowel syndrome. It's sort of one of those things that doesn't have, of course, that didn't stop us from pushing drugs, but it is fairly common and it does tend to be chronic. As we heard about Kimberly, and I'll see if we can play Kimberly's story here again for us. I think I got to do that from over here. Kimberly doesn't seem to be at home. Let's see if we go to a different view here and do this. So anybody have questions so far on the GI disorders or? No, that's a different view. That's the view I want. No. It just seems to want to go back to that page. Sorry about that. Oh, it's zip along. Typically when I embed these videos, I can get them to start automatically. And sometimes they'll start on a click, and when I was running through this at home, it would start on the click, but I guess it's not going to want to do that today. So let's take a break. Let's see if I can figure that out. Yeah.
I was healthy on paper, and I thought, I was living my life, but I wasn't. I thought I knew how to eat healthy. I had the same doctor my entire adult life. I've been a member of Kaiser since 1976. I knew what it was to eat healthy. Oh, eat this, don't eat that, eat this, don't eat that, cut your calories, da-da-da-da-da. It didn't work. I had IBS every day, multiple times a day for, God, don't want to cry again, for my daughter's entire life. 3 days after changing what I eat, I've not had IBS. And that's been almost 3 months now. I don't have migraines anymore. I have fibromyalgia, but I'm almost not going to claim that anymore because I feel so much healthier. I have so much more energy. I just am so excited. I've lost over 40 pounds in 2.5 months. I thought that I knew what it was to be healthy. I thought I was stuck in the life that I had, having fibromyalgia and just existing. I am so grateful to everyone here that started this program because I have a life now. I can live and enjoy my life and spend time with my kids and not just sleep all day long. And I never would have been able to experience any of that if it wasn't for EarthSave and Meals for Health.
So she doesn't know why her irritable bowel syndrome got better, but she also is an example of unintended consequences. For her, it was all good. Her challenges after the program, though, she was involved in 2 more accidents, motor vehicle accidents. I'm not sure how well she drives. But her 32-year-old son moved in and started doing the cooking. So her weight started heading in the other direction. So, but you can imagine what it's like as a physician to labor under a standard practice for like 30 years and then had to take care of people like this. It's pretty rewarding. So let's talk about the autoimmune disorders. First, you have an immune system. It's your defense mechanism. And it's whole designed to look around your body and say, is it friendly or is it something I should be doing something about? And there's like an innate immune system, and then there's an adaptive immune system that came along with all the jawed vertebrates and beyond. And there's memory, and this is where you develop antibodies and antigens. This is a system that adapts to these new things that are coming in. So an autoimmune condition is where your body starts attacking itself. And this can either be a specific organ, like thyroid disease is probably the most common one, where people, women more than men, start knocking off their thyroid at about age 40, and we give them thyroid medications. That's pretty straightforward. It could be like my son. You know, I'm a doctor, and even though I surrender my license in April, I'm still going to get these types of calls, but I wasn't ready for this one. My son calls me up, my oldest son from Oakland, and says, Juliet, that's my oldest granddaughter who's 12, looked at me, she said, you don't have any eyelashes on your right eye, and your eyelid is drooping. And he said, I looked in the mirror and I don't think my eyelid's drooping, but I don't have any eyelashes. What do you think that is? I get these calls, right? I said, well, are you losing hair anywhere else? Because the only condition I knew about was alopecia areata, where people lose patchy things, fairly common, more in women actually under the age of 30. And John's 43, almost 44 now, I think. I'd have to look. But basically what happens is his lymphocytes have started to attack his hair follicles. And I said, John, you got to call your primary care doctor. You're probably going to have to see a dermatologist just to get a diagnosis, because you want to get a diagnosis. So he went in, called his primary care doctor, didn't think that's what he had. He got the derm fellow, who's a primary care doctor, who's got extra derm training, and said, that's probably what it is. Sent him to the dermatologist, said, I've only seen, this is only the third case I've seen in 25 years involving the eyelashes. Well, there's a condition, alopecia areata, is where you lose patches. Alopecia totalis is where you lose every hair in your body. That's about 10% of the cases, and that's where it looks like he's heading at this particular point. He sent me a little picture of himself from the barber in Berkeley. He said the full Bezos. You know? So he just said, well, I can either look, you know, with long hair and patches all over the place, or I can just get the whole thing shaved off. So that's what he did. So fortunately, that's a little bit in vogue these days, you know. The other are systemic diseases, where you might be going after, you know, a lot of tissues in your body, and you're going to see a case of that. So you've got arthritises like rheumatoid arthritis, where the organ that is targeted is the joints. Where you've got thyroid, we talked about. Type 1 diabetes is where the body has killed off the beta cells in the pancreas, so you don't make insulin anymore. Remember, we talked about diabetes in the first class. We got type 1, type 2, and type 1.5. But the type 1, which is what my son-in-law has, he knocked off his beta cells. It looks like the leading candidate for that is dairy, actually, dairy exposure. When you metabolize casein, which is one of the main proteins in dairy, it gets broken up into pieces, gets in the body, and some of those pieces look very much like, even though they're foreign to the body, look similar to the proteins on the surface of the beta cell. And there's a cross-reactivity there. Crohn's and ulcerative colitis are diseases where the body's attacking the small intestine and some of the large, and this is almost always the large intestine. Celiac disease, which everybody has heard about with the gluten thing, it's attacking the small intestine. And it looks like the mechanisms that are common to all these things are exposure to animal proteins and leaky gut. In other words, if by eating the wrong types of food, your gut isn't healthy and it develops leaks, and it actually lets endotoxins, which are bacterial toxins that the bacteria make that aren't killed by your stomach, it gets into the body. The other interesting thing is animal fat. Any sort of fat gets absorbed by the body through the chylomicrons, and it actually gets right into the blood. It doesn't go through the liver like most of the blood does. Most of your nutrients that come out of your GI tract go through the liver. Liver sort of filters it. It's sort of like a detox organ. But fat brings things into the body that circumvents the liver. Of course, it always gets there eventually. New 5GC is interesting, because when I was taking care of people at the Sacramento Food Bank in Sacramento, one of these ladies had bad arthritis, and she came in like the second week of follow-up, and she said, I don't have to use my cane anymore. I can take a bath. I don't have any inflammation. All my inflammation's gone. I said, how long did that take to go away? She said, about 5 or 7 days. That's interesting. My wife noticed after we started eating better that her hand inflammation got better. New 5GC is a sialic acid which is made by animals other than humans. And it's in the meat of animals. So when we eat it, it's a foreign substance to us. It actually gets in the body. It's been shown to have inflammation in the arterial tree. I've never seen any studies on it in the joints, however, but I will tell you that the half-life is about 5 to 7 days. So once you take people and you take them off animal meat products, they get rid of their new 5GC out of their urine. The because that's the way it gets out of the body within 5 to 7 days. So my guess is that's when I see a good number of patients who get better within the first week with inflammation in their body. I would imagine it's probably due to this, getting rid of this. The other thing I bumped into are patients occasionally with rheumatoid arthritis or lupus who are eating no animal products, but they have flares due to certain plant foods like the nightshades and things like that. So the first step is to go to a whole plant food with minimal processing, and then if you're still having attacks, look at the labels of the food you're eating, but also eliminate these high-risk foods. And finally, McDougall has what's called a diet for the desperate, which he published in December of 2002, which is pretty much, I don't think I would do that to my best friend, but it's a pretty bland diet. Gabriel Fenimore, who was a young dental technician from back east, during her dental hygienic training school, developed severe ulcerative colitis. She was having 12 bloody diarrheal stools a day. And she was getting all the medications we throw at people, the enemas and the anti-cancer drugs and prednisone and everything. And she was still having problems. And they were talking about taking out her colon. So she looked around and came across the McDougall program. So her family said, you gotta take a leave, we're gonna pay for you, go out to the McDougall program. So she went out there and she stayed there for 10 days, but in the first couple of days she wasn't getting any better. She was getting worse. And she met with Jeff Novick, the registered dietitian with McDougall, and he said, well, you know, your colon is just burned, basically. We've got to get you on something really simple. But this lady was down to like 75 or 85 pounds. She had no nutritional reserve. You couldn't fast this lady. So we put her on pureed squash. That's all she ate. And at the end of 7 days, she still wasn't feeling good, so Anthony Lim, who works with McDougall now, is the medical director there, but also over at True North, transferred her over to True North, which is where the water fasting program, Alan Goldhammer's program, but they kept feeding her squash because she didn't have any body reserve to tolerate a water fast. And on the 7th day at True North, she had the first normal bowel movement she'd had in 15 years.
Wow.
Pain went away. She went home to her doctor, and her inflammation markers in her body had gone from like 20 to less than back to normal to 1 or 2. He says, what have you been doing? She said, it's just the food. He didn't believe her. But she has now got herself up to, the last time I saw a video of hers about 3 or 4 years ago, she had gotten herself up to 15 foods that she could tolerate. She did have plant foods that would trigger her symptoms. But she has normal bowel movements now, her energy, her weight's back up into about 110 or 115 pounds, and she's feeling much better. So, lupus is an interesting condition because it not only affects the joints, but affects the kidneys and lots of other organs. And I was fortunate at the Berkeley program to take care of Devana. Going in the wrong direction here. There we go. Now see if we get Devana.
To anyone who had anything at all to do with this, including our coach, who did reach out to me at least a lot, I just say thank you. I never thought after I got diagnosed with lupus, which caused me to go into kidney failure, that I would ever feel normal, ever, honestly. Waking up tired every day, in pain every day, just not having your hair come out, and I came out of the hospital with 26 pills a day and a shot that I gave myself in my belly, and I never thought that my life would be different. My medications would change, but pretty much the fatigue and just feeling so less than myself just kind of remained the same. The very first weekend, with the exception of the horrendous gas that I had, that very first weekend, that Friday, that Saturday, that Sunday, that Monday morning, I woke up by myself at 5:30. I woke up without pain, and I noticed it, because when you have lupus, you notice things like that. I sat up in my bed, and Monday is an off day for me. I got a cup of coffee, because Jeff said he would not give us a hard time about the 1 cup of coffee. So I got the coffee, I went out on the deck outside, and I just sat there and I cried, because I just was like, I cannot believe I just got up by myself, and I wanted to get up, and I don't have any pain. And so it's been like that for me. My energy level is, everybody noticed my energy level, especially my coworkers, because they were like, I don't know if we can handle you going back to the way you were. My attention, my focus, I'm off 2 of my medications, and I have secretly tapered down some of my other ones. But Dr. Forrester said to wait for my kidney doctor and my rheumatologist to do the other stuff. But I am just encouraged, because I know that I'm gonna come off the remainder of that medication. I am, without to be graphic, peeing all by myself without the use of some of the medications that I took myself off of. So I just feel very grateful, and overwhelmed, because I really I knew I would feel better, but I didn't believe I could feel this much better in such a short amount of time. It is just miraculous. So I just thank God. I thank this program. The funding for this I could not have done this without the assistance of the food, Dr. Forrester. I could not have afforded to do this. So this was just an awesome blessing.
Admission from her physician. The reason I referred her back to a rheumatologist or a nephrologist was I had no idea what the hell I was doing. If you come in with diabetes type 2 or high blood pressure, I can talk to you about those medications, but this lady was on like 10 different pills. Gosh knows what the interactions were. I pulled her off a couple of the ones that I knew she could tolerate coming off of, because her blood pressures got better, her urine function got better, her kidney function got better. Her cholesterol dropped dramatically to normal levels. She didn't have to be on a lot of that stuff. I knew that, but all the other stuff I didn't know about. So I just kicked her back to those doctors, and I knew I was probably dropping her back into the hornet's nest again, because they're going to start throwing her back on those medications. But she already had a taste of success. So here again, you can imagine, this is an example of somebody who has a disease, and we were providing tertiary treatment for something by pushing pills at them, but not curing their disorder. But these are the sort of things that it would be interesting to know what the incidence in the population was if people were eating correctly across the whole population. Yes, ma'am.
For those of us with autoimmune diseases, we get a lot of information, right, thrown at us, and they're from A to Z and contradictory and everything.
Nope.
And one of the most contradictory ones is the keto diet. And that many people, testimonials like that one, for example, I have rheumatoid, so they go, that my inflammation's down, I have energy, blah, blah, blah. And it's totally the opposite of that. So
Well, there are different types of keto diets. There are the keto diets that push a lot of animal products, and then the keto diets that push a lot of carbohydrates.
the
Low.
one, yeah.
And so you get different responses, but generally speaking, there's not a lot of good scientific support for the keto diets. Having sound scientific basis to make recommendations has never stopped people from selling a product or creating a book or writing a book. Did I tell you about Slim Fast? I told you about Slim Fast. Slim Fast, it was a successful diet because there was no salt added. So you're going to lose weight for the first week or two, water weight, basically, but you're doing 10 or 11 milkshakes a day. Chocolate even. You're losing weight. These guys made millions of dollars on that diet. And it always worked. People always lost weight, but it had nothing to do with getting rid of fat. It had a lot to do with just getting them on a low-salt diet. So you're right. There's a lot of information out there. And because you're an experimental one, all I can do, and I don't know which autoimmune disorder you have, there are over 125, by the way.
Oh, rheumatoid.
Rheumatoid, yeah. I would tend to do this and work with your clinician to see if they can reduce any medications you're on, and let them choose and you choose based on your information which medications you want to try and get off of. Because I've got a rheumatologist that I bumped into at the gym, who I've got a lot of respect for, who was talking about how excited he was that the biological agents were starting to work for some osteoarthritis. And the biological agents, which are very good at treating rheumatoid arthritis. My mother had rheumatoid arthritis back in the days when they were giving gold shots.
Yeah.
And those biological agents have a lot of unintended side effects. And long term, we don't know. I know, it's really spooky.
Scary.
Yes.
Those are biological agents.
Biological agents, oh, geez. Could have read that before I came in. Are there agents which are designed to actually, you want to give us the short version?
Oh, the short version, it's a biologic immunosuppressant and it goes after certain, like the what is it?
T cells in the,
The T cells, and then there's the JAKs inhibitors, the T cell inhibitors, and there's coming up with different pathways to get the immune system.
interfere with your immune system, so your immune system doesn't attack you.
Yeah, but one of the awful side effects is getting your immune system so low, you're susceptible to all, everything else.
Right.
And other things start happening.
Right,
So
unanticipated consequences.
It's a either or situation.
Yeah. So that would you'd have to work with your doctor on that, but clearly, I think I always run this, the newest drugs are the ones I got rid of first. Because I was around long enough that drugs that would come out that would look good for years would all of a sudden prove not to be good. Because the FDA would approve something based on 3 to 4 weeks of data, but when you put the whole population, the one that sticks out of my mind, just one would be fen-phen, the 2 drugs for weight loss, that some doctor in New York, for some reason, put the connection between fen-phen and valvular heart disease and blew the whistle to the FDA, and then they've taken all that stuff off the market because it does affect heart valves. Who would have thought? These are centrally acting agents here, and this is the heart down here. Who knows, right? Osteoarthritis. Now this is an interesting condition. Number one, it's incredibly common. Present over age 45 in the hands of 40% and the knee of 20%. The people I run around with in the movement, plus guys like McDougall and people like that, they say part of it's due to the fact that you're putting a lot of stress on all your joints all the time, like your knees and your hips. And if you have a good arterial tree, your body can repair that. But if you screw up your arterial tree, then you run the risk of not being able to repair itself. And the second session was on arterial health. The other is things like the new 5GC and the endotoxins that actually cause the inflammation in the joints themselves. It's very costly. This is just the cost in 2009 for hip and knee replacement. It's gone up a lot since then. So here again, whole plant diet, healthy body weight, aerobic and strengthening tailored to whatever your arthritis is, because you don't want to stress the joints too much, and it has to be tailored to your individual needs or specific joint exercises. Like if you just have knee arthritis, maybe just the quads and the hamstrings need to be strengthened. And losing weight, of course, and specific walking aids or adaptations at home and work. That's sort of the approach to osteoarthritis. But here again, I've been impressed that the people can delay these sort of things. One of the problems is, as we get older, we get wear and tear. They did a study in 55-year-old men, 55 to 60, I think it was. And these guys were active, dumb human tricks. They injure their knee. They go in, they get an MRI, torn meniscus, right? We can fix that, right? Easy. They take half of them in for surgery, open them up, fix the meniscus. The other half, they take them into surgery, open them up, don't do anything. They give them permission for this, by the way. They just didn't know which side they were in. Which group do you think did better? The one they didn't fix the meniscus. One of the things we're missing when people come in and we see this wear and tear is we don't have a before picture. If the tear was there and you injure it and it's swollen and it's still there, well, and the other thing is maybe we ought to give it time to heal, and we don't have good sense for timelines. I don't know if I shared you my story with my hip, because I limp around, you may have noticed. I have limited range of motion in my right hip because I was riding a bike and I dropped my bike and I had an impacted femoral neck fracture. So if you have the feet, it just sort of, I hit on the side. And the fact that I had 75 pounds of groceries on a loading touring bike when I did it probably had nothing to do about it. Even worse than that, the lady down the street who had polio and is in a wheelchair offered to take the groceries home for me. I told her no, right? decision that will forever haunt me. Of course, on the other side, if I hadn't done that, I'd probably been out riding my bike and I might have been hit by a car and killed by now, but who knows? But at any rate, you know, the surgeon that did the surgery, you know, my wife's sitting there saying, you know, there are a couple treatments for this. They can just put in a pin and kick you home and put you on non-rate bearing. That's what we would have done in the old days. Or you can put you can actually just do part of the joint. But when she got in there, she said she found arthritis in the rim, so she gave me a total joint. So if you x-ray anybody over the age of 60, their back and hip and knee, you're probably going to find wear and tear. I don't know what that means, okay? But I do know that you're probably better able taking that with a grain of salt and realizing that that's probably a fairly common finding. So this is how I would approach osteoarthritis. I don't think it's an autoimmune disorder as we know it. It may prove to be, but that isn't going to stop the drug industry, because we've got lots of people with osteoarthritis, and if they start throwing biological agents and they do a small study that shows there's a benefit there and they start pushing it, you're talking $40,000 and $50,000, $60,000 a year. I don't even know what that stuff costs, but it's crazy. Okay, so yes, ma'am. Question.
What is the whole plant diet? What is that involve?
Just eat plants. Don't worry about labels, because whole plants don't have labels on them. When was the last time you saw a potato with a label on it? You may have these little stickers if they're organic or not. But I would say just eating plants. So the approach to this, and Twyla gets into it in her class, although that's full now, and I was going to push it, but she says that she's full and got a waiting list, because they kicked her off campus because she can't do food here, and she's into cooking, showing you how to cook and stuff like that. Just go to your foods that you use regularly, you know, breakfast, lunch, and dinner, those 10 or 15 things you do on a regular basis, and just get rid of all the animal products and dairy products. Just put plants in there.
So where are you getting your protein, beans?
So I get the protein question, and we just to go over it again. You don't need protein. You need essential amino acids. Those are the 8 or 9 amino acids to build the proteins you need. Your body's got a lot of protein in it. It's constantly breaking down its proteins and scavenging the amino acids. So the trick answer to your question is, where do you get your protein? It's your own body. But you need to make up for some of the stuff you lose. And if you look at the essential amino acid profile of broccoli, eggs, and asparagus, they're identical. So the quality of protein in broccoli and asparagus is identical to eggs. It's just in a much more concentrated form in eggs. And we've talked about how animal protein is bad news for your kidney. So there's never been a case of protein deficiency reported in the history of the world with adequate calorie intake. As a matter of fact, the IRA prisoners that died at about 80 days when they were fasting on water, they finally kicked off, mainly because of infections. They were autopsied and they had plenty of protein on their body. They had just lost all their fat. And since your brain is 25% fat, their brains had started shrinking and they had lost their immune functions. So they died of infections. So protein is nothing you have to worry about. They put 2 people in the 1929, the paper, 2 people, a man and a woman, physically active, otherwise healthy, on nothing but potatoes for 2 years. They did fine. The only problem was they lost too much weight because they were active, and they had to put some oil on their food just to give them some concentrated calories. But they did fine, and that's a white potato. Good question, though. The protein myth is out there. Now, if you are an endurance bodybuilder and you want to do protein, I don't know the literature on that. It might make you look bigger. I don't know. I don't think it affects the strength at all. But you could also, how many people have seen the Game Changers? They've got an interesting take on that. They've got some interesting athletes in there. Now that, as Michael Clapper, who's a former colleague of mine, I got to know Michael because he used to work at McDougall in True North. And Michael's an old guy. He's been doing this stuff for, as long as I've been practicing medicine, Michael's been doing this stuff. And he said there may be some people out there, 1 or 2 people isolated in the population that do better on an egg once or twice a week. But he hasn't come across one yet, but it's possible. So there is population variability. So I would just change your diet. See how it works for you. And if it works for you, you're in experimental 1. Keep going. Any more questions? It's a good question, though. Very common. Back. Low back pain. 1 out of 4 people at any given time in the United States has back pain. It's the #1 work-related for people under 45 in the U.S. for work disability. It's the most common reason reported for missing work, second, and it's the 5th most common visit for a physician office visit. Now, I'm going to give you a reference here in a minute of a book by a guy named Stuart McGill. And it's one of those really depressing books that I read after I retired. Because after I read the book, I realized I'd never treated any low back patient that ever came in to see me in the office appropriately. It ranks up there with the article I read that I never took an accurate blood pressure because I didn't make sure people's bladders were empty and I didn't talk to them and they didn't talk to me. And, I mean, I got sort of the size of the cuff and then, but all these other little things that affect blood pressure I didn't know about. When I was playing basketball in high school, they told us not to lift weights because it made us muscle bound. And then when I went to college and played some basketball, they were letting us lift in the off season. And now they lift weights all year round. And somewhere along the line, they discovered the core. Have you heard about the core? All these muscles are your core. The interesting thing is that, and this is the book by The Back Mechanic by Stuart McGill. It's a little pricey, about $37, but it's in paperback, so you can probably get it at the libraries. Muscles in on your extremities, they use to move things. The core is basically there just to stabilize, basically. Because if you look at your back, it's just a bunch of bones. If they were there but with no support, they're just going to fall down. It's all the muscles around the back that affect the back. So, this guy is a non-physician. Stuart McGill is a PhD biomechanical guy up in Toronto. He's been studying backs, has 500 papers published, one of these sort of guys. And he comes up, if you don't have back pain, he comes up with 4 exercises that will protect your back and strengthen your core so you won't minimize the possibility of having back pain. This is like a modified curl up, a bird dog. That's the hand and the leg on opposite parts of the body, and a side bridge, which I have trouble doing on my hip side. And also walking 30 minutes a day with the correct posture and arm swing. Because when you're walking, you're using your core at the same time. So those are examples of core stability exercises. He's got another one called a camel where you're sort of arching your back too. But these are the big 3.
Go back to 1 second.
Yeah, okay. There you go.
Thanks.
Yeah, and all this is in the book. What I like about this book, because it's into self-care, it actually runs through a series of steps you can take at home to figure out what your pain triggers are. And he's got his theory. What he wants physicians to do when they see people is to go through those sort of exercises and figure out what their pain triggers are, and then you avoid your pain triggers and you work on the non-pain triggers and you strengthen that, and then you go to a specific set of exercises based on what your pain triggers are. So for me personally, I have to do these exercises in the morning because if I stop doing them, when I roll over in bed, I get a sharp shooting pain. And what he says that is just weakness in the core. So by me doing these exercises, full admission, I don't walk 30 minutes a day. I'll start that after this series of classes is over. It seems like the other, and that was, the reason I learned about that book was Jack Dixon at the McDougall program. The second book he talked about that I already know about, I'd already known about Esther Gokhale. Anybody here know about Esther? Okay.
She spoke at Kaiser.
Huh?
She spoke at Kaiser.
Did she speak? Did they learn anything?
Yes.
So Esther Gokhale is a chiropractor who had a bad herniated disc and had surgery, and they were going to do it again, and then she suddenly did some research, and basically her thing is the primal posture. This is an anatomy textbook back in 1990, and this is one that was published in 1911. And if you look, it's a little subtle, but if you look at it, this is more of a straight spine with a little tail at the bottom, and this has got the double curve in it, the S shape, right? She says this is the way we should be. And if you look at primitive cultures around the world, primitive, I use the term, it's like Gandhi once was asked, what do you think about Western civilization? He said, I think it's a good idea. So I always a little careful when you call these other cultures primitive, right? But if you look at their backs, they're pretty straight. You know, they're stacked, they're set. But if you're over a prescription pad all day, or the computer, or sitting slouched, or you take the little babies, you stiffen these car seats, and they're down and stuff, you get the normal changes. So I don't know. I mean, I'm a fan of the J-spine and teaching people to change how they sit, stand, and sleep. But the only concern I have with Esther's method is if you've got somebody with a lot of curve in their back, I don't know if they've been doing that for 60 years, you want to get them back to a J-spine, or if it's even possible. And for me, that gets back to you're an experiment of one. You know, so you just have to figure that out yourself. But I think the idea of strengthening the core, sitting better, standing better, walking better is excellent. I think she makes a lot of good points. And she has some, if you look her up, she does do talks on this. She's done in Seattle, it's the one I've watched. She maybe even done a TED Talk, which are usually a little shorter. I like the longer ones because they usually tend to get into the science a little better. But this is the sort of thing you won't see. I mean, I've never heard about this in 30 years at Kaiser. Of course, I retired in 2008, so maybe they're catching up a little bit. But her thing is the J-spine here, as opposed to the S-spine, and primal posture, you know, the posture we should have. So, experimental one. I tend to stay away from GMO foods as much as I can because there's just been no study on them, and the industry is very good about taking professors who've done any research that looks bad and getting them kicked out of universities and things like that. The vitamin B12 is, like I said, the only vitamin that you really make sure you need to have. Vitamin D is optional. In my respect, because it's fat soluble, you don't want to take too much of it. So if you take 2,000 to 3,000 a day, you won't get into the toxic level, which is about 100. But this whole cutoff at 20, which went up to 30, which got all sorts of people taking vitamin D. There was one study with Hawaiian lifeguards that had 26 and 27. These people were bronze, you know. So whether they benefit from vitamin D supplements would be a little bit of a stretch in my mind. We started to get into fitness a little bit with the core. We're going to talk about this a little bit more in the next two talks. But you want to start thinking about functional fitness, which is what Jack's talk is about. How you can actually be functional in how you want to do. I mean, if you've got grandkids that are small, do you want to be able to get down the floor and play with them? You know, what is functionality for you? And then keeping current. So here's a cartoon where the guy's telling his doctor that diabetes has increased dramatically over the past 20 years, and that proves it's caused by global warming. As serious as global warming is, and we're going to talk about that a little bit in the class, I don't think it's a cause of diabetes.
How much B12 do you recommend today?
It was B12. How much B12 do I recommend? Before 2 weeks ago, I would have taken 2,500 once a week. And the vitamin B12, Gregor does the numbers on that in a February 2012 lecture on B12 recommendation change. But I just went through a webinar on Michael, and he says he's changing it to 1,000 a day for people over the age of 65. God, ageism is just so sad. And I said, okay, so I've got these 2,500 pills, and they're starting to run out. And I'm going, well, should I get 1,000 and take every day? He didn't give me the science on it. Should I continue with the 2,500? My level's pretty good. So I shipped him an email. Now I've sent him 2 emails. Okay, Michael, where's the science? He's doing a webinar. Nutritionfacts.org is doing a webinar in May on vitamin B12. I'm sure I'll get the result before then. I'm hoping he's going to get back to me before the end of the session so I can get it out to everybody. But currently, I'm taking 1,000 a day. But I just started that the other day. The difference between cyanocobalamin and methyl is the methyl just has a little shorter shelf life. They're both probably acceptable. I get some questions about how you choose your doctors. Boy, that's a real interesting question. Here's the one doctor. I can't tell you how glad I am to finally found a doctor who doesn't harp on me about our weight. And then there's the Neil. You know, you've made a pretty well impression on somebody when you end up in their cartoon. This is Dan Pereira Bizarro. This is Neil Barnard for the Physicians Committee for Responsible Medicine. Welcome to McSteeney's All You Can Eat Barbecue. I'm Neil Barnard. I'll be your waiter and cardiologist tonight. Neil's actually was trained as a psychiatrist, truth be known. He founded PCRM in 1985. March 9th, banner day in my life, because I was part of the PCRM suit. About 5 years ago, we sued the FDA to get them to rethink their cholesterol as a nutrient of concern. They were going to take that off. And we did some research. They did some research, and they were looking for some California physicians to sue the federal government. I said, hey, why not? So I did that. On March 9th, I'm one of 2 plaintiffs that are filing a suit against Gavin Newsom, the head of the EPA, and a bunch of other people who have not listed processed foods like hot dogs, sausages, and things like that as Class A carcinogens. By law, they're supposed to have done that by Prop 65, which is 1986, and they haven't done it. And that's what I got in my email box the other day. Gee, Don, you want to read through this complaint before we file it? And this is what I said about you, so I made a couple minor changes and shipped it back. It's a pretty sad testimony on the efforts of people to get them to comply with the law. And while this was going on, they were meeting with the meat and industry. So I'm now adding a suit to the state of California on my resume. Who says retirement is boring and can't create trouble, right? My guess is they'll do it, and before the suit gets very far along, they'll probably comply. But the excuses these people come with, oh, we're waiting for the monograph, and then the monograph comes out, and they still wait. It's like, but the Prop 65 didn't say anything about that. They said, well, the science is clear, do it, right? So supporting your journey. We got Michael Greger, nutritionfacts.org. I would strongly recommend you subscribe. And you can, here again with this website, you can go and look up any chronic condition, food, spice, and just see the science on it. I get asked why my physician doesn't know this stuff. I said, I don't know this stuff. How do I keep up? I keep up by paying attention to people who sort through this stuff and come up with the meaningful stuff. Just sort of what I'm trying to do to you, take it down another level so you can answer questions like, where do I get my protein, or how much vitamin D do you take, and things like, they're actually practical things you can do. If you go up to the sources cited, he gives you the list of the articles he quotes. And if you click on the article and the reference, it'll actually give you the abstract of the article if it's available free. Last year, there were 37,000 articles come through by 27 volunteers to give to Michael to run these videos. Yes, sir.
I noticed some of the videos, they're dated. I mean, but is it still relevant? It's still...
Yeah, usually he updates things pretty well. You're right. He started doing this because I was going to introduce him when he was in town, but then they had technical problems and I couldn't introduce him. So he started giving talks to groups back in 2006 when he was the head of animal husbandry and public health for the Humane Society of the U.S. They let him go to the NIH twice a week and just read articles, and he would go around giving talks. A very interesting sort of talk. Everybody stands up, and it's like, okay, what's the answer to this? And the people that get it wrong sit down. And it keeps going until there's one person standing, and he gives them a video of all the articles he was talking about. That's what he did. And then in 2010, the Jesse and Julie Roush Foundation gave him $1 to $2 million, probably $1.5 million, I think, to put it on the web and come up with nutritionfacts.org. So it was funded to start. And that's when he started doing nutritionfacts.org. And he asked me to be on the board starting in 2013, which is literally one of the easiest jobs in the world because it's a 30-minute meeting 4 times a year that he runs while he's walking on his treadmill, of course. And it's just we're doing well. I mean, there's 4.1 million hits last month, been translated to 40 languages, been viewed in 193 countries. His first book, How Not to Die, is still number 8 on the New York Times bestseller list. How Not to Diet, which just came out in December, is number 2 on the New York Times bestseller list, which really bumped him out. You know how these docs are, they like to be number 1, right? He said, if I can't make it number 1 on a New York Times bestseller list with a diet book, I'm never going to do it, right? He's talking about doing one on aging. I'm trying to get him to do one on cancer. But he's one of those guys that just, you ask him questions, he just comes up with the answers. But it is current material, and if something comes up that's new, that's different from what he's done in the past, he'll do another one. But there is sort of a limit, but he is doing what's called Flashback Fridays now, where he's going back and finding popular ones and bringing them on Fridays. He did that for 2 reasons. One is it decreases the number of new videos he has to do, so he doesn't have to, because now he's going to 200 cities this year. I mean, the guy's travel schedule's insane. John McDougall's health and website, he has great newsletters. Yes, ma'am?
Well, you're still on Gregor. People who don't know how to get started on this or don't know what to eat, he has an app for your iPhone, free app. You can get it in the App Store, and it's called The Daily Dozen. Have you looked at it?
Yeah, we've got it on our refrigerator.
And it's interactive, so you could check out, you're supposed to eat these many portions of beans, this cruciferous fruits, whatever. And it gives you a good idea of how to...
And you found it useful?
Oh, yeah, especially for people who are just starting out. And then you add your little check marks, and then at the end of the day, it goes away, and you start over the next day. So it's very helpful.
Yeah, it is.
What's it called again?
The
Daily Dozen.
Dozen.
Now, what he's got in his new book, he started to write this diet book, How Not to Diet, right? He figured he was going to write a chapter on keto and a chapter on this, and a chapter on that. Figured this is going to be out of date. So the first third of the book, and there's a disclaimer here, the book's 500 pages long. And the 450 pages of references are on the website. So the first third of the book is how we got into the problem we're in. It talks about marketing studies, which is real depressing. The middle third is how you evaluate diets. He came up with 17 criteria to evaluate whatever diet comes out. And the last third of the book is the 21 tweaks, which you can add to your daily dozen, right? Which are things that have been proven to help weight loss, to tweak weight loss, like vinegar, 2 or 3 teaspoons 3 times a day, or whatever it is. Turmeric, I mean, little tweaks.
Eating calories, most of your calories before noon.
Yeah, the tweaks. So, I mean, I haven't even gotten through the tweaks yet. I haven't gotten to the end of the second part of the book. It's like, because for me, going through this stuff, I'm getting all these references I gotta look up. Thank you for bringing up the Daily Dozen.
Yeah, it's very helpful.
Very helpful. And that's what this is all about, is trying to find helpful things, I mean, it takes a while to learn that you can actually saute food with water or broth instead of oil. You've got to watch it a little closer. But your taste buds do adapt. They do adapt after a couple weeks, and it varies from... I saw something the other day where your taste buds actually turn over every 21 days, which is kind of interesting when you think about it, because if you stop eating something and you start, and all of a sudden something that tasted good or tasted like swill, is now all of a sudden tasting good. Alan Goldhammer tells an interesting story about this. When they landed a contract to take care of the longshoremen of the Bay Area, they could come up to Whole Food, up to True North, and spend whatever they could there drinking water, right? It's a medically supervised water program. They take very good care of you. They've done over 20,000 fasts up there. And this one guy showed up, and he was in such bad shape, they actually let him eat regular food, their regular food, which is whole plant-based, no salt, no oil, no sugar. And the guy came into Goldhammer and said, and Goldhammer says, we're going to feed you. How's the program going? He says, you call that stuff food, Because he was used to eating standard American diet. And then by the end of the time, he had lost weight and things were going better and stuff like that. Alan asked him, he sat down next to him while he was eating, he said, well, how's the food? And the guy says, well, your chef finally got it right. This stuff actually tastes pretty good. So after a few weeks, you do change. You know, it's amazing how you form that habit. John McDougall, his health website, he has free newsletters and educational videos, which are real useful. John provides a little bit of a clinical perspective. One of the problems with both Nutrition Facts and John is there's just so much information there. You know, you've got all this information coming at you. What do you believe? But the reason I like them is they're free, and they're commercial free. They're not going to give your names away. And you'll see as we go through, I've included some newsletter articles. The educational videos, you can even find mine at one of his advanced study weekends if you dig deep enough. But there's some interesting talks on there, and they're all free. Other than the cost of your time, right? Which, as we get older, maybe is not as free as it was when we were younger. Who knows? And then the Physicians Committee for Responsible Medicine, they have some interesting resources for the newbies too, I think. They do these 21-day Kickstarter programs where you can actually sign in and they go through things, and they're pretty well done. And they were starting them every month. I think they're doing them a little bit more frequently now. But they're translated into Japanese, Chinese, modified for the Indian continent, and Spanish. Also, I was fortunate enough to do a presentation, a team approach on diabetes back in August of 2018 for healthcare professionals. There were about 1,000 healthcare professionals in the audience, and those are all taped, and they're up for 2 years. So you can actually go to the CME courses for physicians and actually see their conference, which is in August every year. You don't have to travel to Washington, D.C. to see it. You can pick and choose what you want. And that's a good resource, at least it is for me, because, you know, otherwise I wouldn't know that, you know, I always thought that you were born with the fat cells you got and they just get bigger and stuff like that. But some guy at Yale found out that the fat cells around the middle of your body can actually multiply. That's a little depressing. Maybe this is ethicist trying to get rid of this. What's it?
Just a local resource for the lady question about plant-based. The local meetup group for vegans and vegetarians have, if you sign up for that, you will get notification and connections of all kinds of events that are happening in the Sacramento area and huge amount of support. And then I watch works overnight.
Is that Linda's?
Yes. Yeah.
Linda Middlesworth is moving force behind the Sacramento Vegan Society. Sacramento Vegan Society, they have potlucks every month, usually.
Lots of things. Local restaurants, you'll find out what restaurants have great options for plant-based eating.
And she does once a year, she does a Get Healthy.
Yeah, we just saw it.
We were just there. It begins to remind me of a tent revival. Not that I've ever been to one, but you know, I mean, Linda brought 7 people up on stage that were just
amazing.
Yeah, that was amazing.
Success story.
Yeah, huge, and just local.
And unfortunately, Gregor showed up, and a lot of the people had come to hear Michael speak, and she was having to keep changing her venues, and she ended up over on Howe Avenue, and their video equipment was so antiquated it wouldn't take Michael's talk. So some people were ticked off and left without seeing Michael, but Michael was gracious enough. He stood up there and answered questions, and that actually worked pretty well. And I think the last class we have here, I'm going to most of the last part of it's going to be question and answer, because I really want you to walk out of here with as many of your questions answered as you can. And you got to remember, you'll go home and change things, and then you're going to have new questions. So, you know, everybody's different. So, at any rate.
So again, your resource was the Sacramento Vegan Society?
Yes, and you'll get hooked into the Meetup
Okay.
app. You can find it through the Meetup app if you say that one of your interests is vegan or plant-based eating. And then you'll find out all about things Linda organizes and tons, way more than you could ever absorb.
Thank you.
Yeah,
the Sacramento Vegan Society has a lot of resources. That's a local resource for people. There's also a Sacramento Vegetarian Society that was out at McClellan. They did an event out there that I spoke at, and they were sort of together, and then there was a falling out, and the vegetarians went this way, and the vegans went this way. You know, It's like, I was Veg Source. I didn't tell you about Jeff Nelson's story. I've got a little time, so I'll tell you Jeff Nelson's story and how he got around McDougall. His wife developed relapsing polychondritis, which I had never heard of before, but is a rheumatological condition which attacks the cartilage. So nose, ears, cartilages just are inflamed. It's usually fatal, actually, after a few years. She was going to a rheumatologist, and they were pushing drugs on her. And she came across this McDougall book. John's, one of those guys, written 12 books. And it's a McDougall program, and she brings it down. Jeff's coming down the stairs, and she gives Jeff the book and says, "We're doing this," right? So they start doing it, and within a year or two, she's off all her medications, her inflammation is gone, her symptoms are all gone. And then they start doing Veg Source, which is their annual meeting down in LA. They haven't done one the last year or so. They may be doing one this fall. But that's what Jeff Nelson, that's sort of how he got involved with the McDougall program. And they were one of the first people to do these sort of conferences. Now there are these conferences everywhere, like Linda does every year. And she had really good speakers. And Goldhammer spoke. The other resource for people that want to see people who are really good speakers who cover certain topics is you can go to the Hawaiian Vegetarian Society. And for every year since 90-something, they've been having monthly meetings the first Tuesday of every month, and they videotape it and put it on TV down there, but also put it on their website. So if you want to hear Alan Goldhammer's talk, who hasn't changed a lot on fasting, gives the same talk all the time. I change my talks all the time based on my audience, but so I'm there. Actually the talk I gave there was titled Delaying Death and Avoiding Disability. And in preparing for that talk, that sort of primed me for this course, because it suddenly dawned on me I needed a little bit more time than an hour. And actually the talk I gave there was an hour and 12 minutes. And they put me on TV, it was an hour slot, so they had to cut out part of the talk. They cut out the Alzheimer's and dementia part.
I watched a lot of them on YouTube. I didn't know you could just go directly to...
Yeah, there's a way, if you go through their website, you can find a list of everything. There are some exceptions. Jeff Novick went over there in the early 90s to talk, and he wouldn't give him permission to put it up. The speakers have to give permission, but Jeff's got stuff on YouTube now. So there are some good resources, Physicians Committee for Responsible Medicine, for people that want to learn more about it. Because once you've got the concept of what it is and how important nutrition is, and the question is, what are you going to do about it? Giving your own support. You are a group animal, right? I mean, you do live in a community of family and spouses and kids and grandkids and all this sort of stuff. So, at any rate, we got you out about 5 minutes early. I'll stick around for questions. Thank you very much.